Hey everybody, I'm Dr. Michael Miyazaki here again, and today we're going to talk about what I called advanced etching. Um, have you ever been in a situation where you've got a very deep area of decay and you clean it out and you know you're close to the nerve and you're feeling about putting that phosphoric acid that deep into the tooth kind of concerns you? Or have you ever had that situation where you're maybe have a deep margin and the tissue's bleeding and you use your hemostatic agent and stop the bleeding? When when you put that phosphoric acid back onto that tooth in that area, it's going to elicit the bleeding to start up again. And that's a challenge. You just can't get that blood to stop coming out. And how are you going to bond your direct restoration and your crown in place? That's a challenge. So what we're going to talk about is a couple ways around this. And I'm calling it advanced etching because a lot of us just think etching, especially on just the tooth, is all about phosphoric acid. And I'm going to hopefully shed some light on that today. So we're going to move ahead and there we go. So here's my restorative armamentarium again. We've got the composite warmer, my seam free, my Bioactive Regen Flowable Composite, my Desensamax desensitizer, my Regen adhesive. And what we're going to talk about is when we cure this, we have our pink wave, our curing light. But on the bottom, we've got our quick stat free at the very bottom. But today what we're going to do is we're going to focus on two products. We have the regular phosphoric acid gel, which in this case is Velvet Etch. But I'm going to focus more today on Clean and Boost. Clean and Boost is a product from Vista Apex that I find can be very, very helpful. So let's go back to what happens when we prepare a tooth. When we prepare a tooth and we have our handpiece, we have a lot of exhaust oils, maybe handpiece oils that get onto our prep. So we want to make sure we clean this off. And one of the things that Clean and Boost is really good about doing is removing these oils or the contamination on our preparation, because we know if we leave that contamination there, we're not going to get a good bond. It was originally developed because back in the day, I don't know if anybody remembers this, but if you have a CEREC, you might remember that we used to have to spray the teeth that we were working on in the preparation with an optical spray. And that was so that the camera at the time could pick up the actual teeth, because otherwise, I guess it was too reflective. So we had to create a matte finish. And so we have this optical spray that we would dry that area off, like you see in this case, and we spray it with this optical spray. And then when we brought our CEREC camera over the top, it could actually pick up the preparation and the adjacent teeth. Well, that spray had to then be cleaned off before we would bond our milled restoration onto that area. And that's where Clean Boost was actually developed. It was actually developed to help clean all that away, to remove the oil debris, and to develop a very clean preparation. So Clean Boost can come in the syringe, and we've got our tips that we can apply it very easily to the preparation with. But it turns out that it is a combination of nitric acid, and the nitric acid gives us the ability to etch the teeth and then also to cauterize minor bleeding areas. Then it has isopropyl alcohol, which is antimicrobial, and that cleanses the surface before we're going to bond anything to it. And it has HEMA that can act as a desensitizer by blocking the dental tubules. And if you're using a single bottle adhesive, kind of your all-in-one adhesive, if you use Clean and Boost on the prep, rinse it off before you apply your single bond adhesive, it can improve your bond strengths by 36%, which is significant, right? That's more than a third more strength. So it's an aqueous cleanser and an etchant, as we talked about. It removes the contaminants, and it's so much kinder to the tissue. So if I had that prep that's really deep and I know I'm close to the pulp, and the whatever etchant I put on that dental surface is going to have a very short path to pulp, possibly irritate it. I might use Clean and Boost. Clean and Boost will etch the inorganic area, your enamel, but it's going to be much kinder to the organic area, to the dentin. And because the nitric acid is very kind to the tooth and that soft tissue area, if I've got a very deep prep and I've got this bleeding going on and I use my hemostatic agent, and I've run into this, I put my hemostatic agent down and the acidity of the hemostatic agent causes the bleeding to start up again. So you hit it again with the hemostatic agent. You apply pressure. You try to stop the bleeding. You get stopped. You put your phosphoric acid down and it starts bleeding again. I don't know if you've ever had that happen. I've had it happen. And it's just kind of frustrating because you know you have to stop the bleeding, but you also know you have to etch the tooth surface, but the etchant makes the tissue bleed. So what do? Is I put the phosphoric acid to the side and I use Clean Boost. The nitric acid will etch your dentin and the enamel surface. It'll be kinder to that deep dentin and it won't allow that soft tissue to start bleeding again. And it just works really, really well. Some doctors don't even use the phosphoric acid anymore. They just use a Clean Boost with its nitric acid. And again, by using the Clean and Boost, you increase your bond strength. It disinfects the tooth surface and it desensitizes because it does have the HEMA. So it's got a lot of really positive properties. So again, we have our Velvet Etch, and I've spoken about that before. I do like Velvet Etch if I'm going to use the phosphoric acid gel etchant. It's 40%. It has this nice velvety, luxurious purple color, not the blue. And when I ask my assistant for the Velvet Etch, I don't ask my assistant for the acid or the acid etchant because that can kind of conjure up different images in our patients' minds. But I'll say, just give me the purple. And they know that if I ask for the purple, that is the Velvet Etch. But that Velvet Etch is phosphoric acid. The things I like about it, it's very effective. It's easy to apply. It's easy to spread, very easy to remove. You can suction it off and then hit it with a little bit of water and it's gone. But because it is phosphoric acid, it can create more bleeding in that friable soft tissue. So that's where I like Clean Boost. Clean Boost, if you're using it as a cleanser, just apply it for about 10 seconds. And so if you're still using the optical sprays, hopefully you've moved on, but if you're still using it and you're trying to figure out how to get rid of that optical spray, then I would take the Clean Boost, put a little Sapflo tip on it, scrub the preparation for 10 seconds. You'll see all that optical spray be removed. Or, if we had handpiece oils that splattered onto our preparation, it's going to remove all that. It's going to clean and remove all the bacteria. Go ahead and scrub that prep for about 10 seconds and rinse it off. In that 10 seconds, it's going to do a very good job on the dental surface. Now, if I want it to be my etchant, so I want it to be my Velvet Etch replacement, then what I'm going to do is I'm going to apply the Clean Boost. It comes in a liquid and a gel. I like the gel because it kind of stays where you place it. Apply the Clean Boost gel where you want it to be and let it sit there for about 20 seconds. And in that 20 seconds, it's going to etch the enamel surface so you can bond to it. And it's going to do that again without eliciting more bleeding. So here we have a prep. I'm going to apply my Clean Boost for about 20 seconds. After that 20 seconds, I'm going to rinse it thoroughly. Again, the Clean Boost has a nitric acid in it, which is going to etch the tooth, clean it, and disinfect it. It's going to be gentler on the deep dentin and do a great job. So I've had these teeth where I know I'm really, really close to the pulp, but I haven't exposed the pulp. Instead of putting the phosphoric acid etchant on that deep area, I'll use Clean Boost, and I'll just scrub the Clean Boost into that dentinal area. I'll go around the enamel area and make sure the Clean Boost is on the enamel. I'll wait 20 seconds and rinse it off, and you will have a nice etch pattern on that enamel surface. And then if you're concerned about, because again, in those really deep prep cases of sensitivity, although the Clean Boost has a HEMA in it, you might use something like Desensamax. So Desensamax is a really good desensitizer. And I know my assistants know if I go, wow, I'm getting down deep into this tooth of my preparation, they'll ask me, do you want Desensamax? And a lot of times I'll say, yeah, give me the Desensamax. If I feel like I could have a sensitivity issue and I don't want my patients to have sensitivity after I place either my direct or indirect restoration, I'll place Desensamax. Now, the Desensamax we don't rinse off. We'll just kind of air dry it, thin it out. It's a reweighing agent into those dentinal tubules, and so it has the desensitizers. It will help to prevent breakdown of my MMP hybrid layer. It's antimicrobial, and it has fluoride in it to help prevent secondary decay. It helps to re-wet the tooth surface. So after I use my Clean Boost, and I let the clean boost sit on the enamel for 20 seconds. I will rinse that off. Take the Desensamax bottle. It has all the goodies in it. So you just mix it up shake it for 3 seconds. Just get it thoroughly mixed and then apply it to the tooth surface. Let it dwell there for about 5 seconds and then dry it. You can leave it slightly moist because again, it's a good rewetting agent, but just try and dry off all the puddle there and get rid of all the excess. So the surface should look shiny, but you shouldn't have any pulled areas of Desensamax on the tooth surface. And then what I like to do, especially if I have that deep prep, is I like to use the Regen Universal Adhesive. Why? Because it has a bioglass. And that bioglass can now penetrate into the dental tubules. So again, we take the Regen adhesive, we shake it up for about 3 seconds. I blot it on to the deep preparation. Don't just blot it on and then dry it off. Let it soak into those dental tubules. So I'll apply it with the microbrush. I'll just kind of agitate it for 10, 15 seconds, and then I'll let it soak in, and then I'll come in with very gentle air because we want to evaporate off the solvents. So very gentle air just to get that volatile solvent to evaporate off. And then I'll come in with more vigorous air, and that vigorous air is to then thin out my adhesive layer because I don't want it to be too thick either. So gentle air first for about 5 to 10 seconds, and then very vigorous air for another 5 or 10 seconds to thin it out. So what we've done is we've gently prepared the dental surface and the enamel surface with our Clean and Boost, our nitric acid etchant. We've rinsed that off. Then we applied our desensitizer. We thin that out. Well, we don't rinse it off. We just thin it out with air. And then we apply our Bioactive Regen Universal Adhesive to get into those tubules and to help the tooth begin to heal. And I tell the patient that. I go, as I'm applying this, we're applying a solution that will help the tooth heal itself up because what we found out is as we cleaned out this restoration or the decay, that it was very, very deep. I just tell the patients we're applying solutions that will help the tooth heal up. So here's a recipe. So step number 1 is I do my prep. And if my prep is deep and I'm down by the tissue, you might have some bleeding. Well, I've talked about my favorite hemostatic agent that is QuickStat free. It is a clear hemostatic agent, aluminum chloride with magnesium and surfactant. So it's not just a straight aluminum chloride clear hemostatic agent. This one is a super duper hemostatic agent that's clear. So I'm not going to have any stain of the tissue, but I will stop the bleeding. And even this week, I got into these deep preps, and as I was preparing the tooth, you saw the blood start coming up, and the whole entire prep is filled with blood, and the sulcus is filled with blood. And my assistants hand me the QuickStat free. I just rub this QuickStat free into that sulcular area. I don't scrub it. I just apply it, and then we rinse it off, and all the blood goes away. I mean, my assistants and I, we always look at each other going, that stuff amazes me all the time. So I got my hemostatic agent to control the bleeding. But because that area is friable, and when I apply my phosphoric acid etchant, I know it's going to start the bleeding to reoccur. So what do? We skip the phosphoric acid and I just apply the Clean Boost. So the Clean Boost I applied in my preparation onto an enamel surface, onto a dental surface, and I just agitate it into that area, spread it well over the entire prep. Wait for 20 seconds, and I rinse that off. It's going to etch the enamel. It's going to prepare the dental surface, get rid of the smear layer, but do it in a more gentle manner. So now we get rid of all the excess moisture off the preparation. If I'm concerned, because I've got a really deep prep, I'm going to apply my Desensamax desensitizer. I'm going to let it dwell for 5 seconds in and on the prep. Then I'm going to air dry that off to get rid of all the puddle Desensamax, or you can blot it off. And then I'm going to apply my Regen Universal Adhesive. I'm going to apply it, let it soak in. So I'm going to apply it, agitate it, apply it, gently agitate it for about 20 seconds. Don't get too fast with this because you want the adhesive to penetrate into those dental tubules. Now we're going to hit it with gentle air for 10 seconds to evaporate off the solvent, vigorous air for 10 seconds to really thin it out. And now you can light cure it, or you can go ahead and put your flowable composite. Again, I like the Regen flowable composite. Why? Because it has the bioglass in it. So again, I put bioglass into the dental tubules. I line my cavity prep with the bioglass, and at the gingival margin, the external surface where that gingival margin is, I'm going to have bioglass to help prevent recurrent decay. I get in there. I'm going to cure everything with my pink wave curing light. Why? It is a high intensity light that because it's so slim in profile, we're not going to have any shadowing as we do our curing. It's going to cure down to 8.5 millimeters of depth. It is just a great high power curing light. So I get back there, I cure that, and then I go in with whatever your favorite composite is, but I use warm composite. So the phaser is an excellent composite warmer and composite delivery gun to get that composite into my preparation. And because that composite is warmed, it's going to flow, adapt well to my cavity preparation. And as I incrementally fill my preparation, I'm going to cure again with the pink wave curing light for about 10 seconds. It's a fantastic curing light. So we're going to get great depth of cure. Then if I have to do another layer, and then I'm going to cure. As I'm placing my composite, I like to use seam-free. So seam-free is a composite wetting resin. So as I'm placing my composite, I'm using just a little bit of seam-free. That's usually placed on the back of my glove. I just kind of, like an artist with their paintbrush, I just gently put a little seam-free on the back of my composite instrument, and I just use that to spread out, so that my composite doesn't stick to my instrument, because if it sticks to the instrument and I pull my composite placement instrument up, I could create a void in my composite. I don't want that to happen. So seam-free helps prevent that. It doesn't alter the physical properties of the composite. It doesn't have any photoinitiators in it, so it's not going to affect the setting of my composite. And it doesn't have any solvent, so it won't affect the physical properties. So again, I'll use seam-free on my composite instrument as I'm placing it. What I then do is I'll pull my matrix out, my wedge out, get my ring and everything out of there, make sure that I can floss and I don't have any excess at my gingival margin with my interproximal carver. And then I'll get in there with my pink wave curing light. I'll cure from the buccal, I'll cure from the lingual, just to be sure that the base of my box and all the axial margins are well cured. Then I'll do my final cure with the pink wave curing light. Everything is all done, hardened, cured, and now go adjust the occlusion, which is very important. And we've talked about that during the last YouTube post. We want to make sure the occlusion is not hitting prematurely or harder on our new restoration, especially if this is a large, deep restoration, because that could prolong the patient's sensitivity. So we make sure the occlusion is just right. Have the patient bite down, have them go in excursive motions, have them seated upright when you check, because head position, like we talked about before, affects the occlusion. And make sure you just have it perfected and polish everything up. So this is my recipe when I have those deep restorations, either deep prep where I know I'm going to be close to the pulp, or deep prep where I'm into that tissue, and every time I even look at the tissue, it starts to bleed. So this is the recipe. Give this recipe a try, and then let me know what you find, if it works for you. And I just want to thank you. If you like this information, if you like these videos, hit subscribe. We'd love to have you be able to be notified when these YouTube videos go up. Hopefully you like them. Put some comments down, because your comments help me kind of stay on track. If there's things that I need to go back and explain better, or things that you could suggest to make everything better as far as the procedure or our content, we're open to all that. We are building a community of like-minded individuals that want to take responsibility for providing the very best for their patients. And so I thank you for watching this video. As we start this new year, it's been a crazy year. We wish you the very best. Remember, at Vista Apex, we want to partner up with you for your success. Thank you very much. Take care. See you next week.